So good morning, ladies and gentlemen. I would like to present our work in behalf of my co-authors. So this is entitled Discrepancies in Cancer Incidence and Mortality and its Relationship to Health Expenditure in the 27 European Union member states. So I'd just like to say that we use 27 because Croatia just entered, so we didn't have enough data for Croatia, so that's why it's 27. So the institutions of the European Union, they work according to negotiated decisions and several standardized policies among its member states. However, healthcare is the responsibility of the national governments, and the healthcare they differ from country to country. In spite of this, the European Union has promoted actions to standardize healthcare, as in the Charter of Fundamental Rights of the European Union, that states in Article 35 that, I will read this for you, sorry. Everyone has the right of access to preventive health care and the right to benefit from medical treatment under the conditions established by national laws and practice. So this makes the European Union a perfect scenario for this kind of research because we have standardized the public policies, efforts to standardize public policies, but still the health systems, they are managed by national governments that invest different money for historical reasons. So our objective was to evaluate what was the impact of the health expenditure on cancer outcome in the 27 European Union countries. And the hypothesis was that the more you spend, the better is the outcome. And this effect should be greater in diseases where you have effective treatments and screening, as in the case of breast cancer. So we extracted data from trustable data banks. So we extracted that data regarding cancer indicators from the World Health Organization, and we established the mortality incidence ratio. That means how many patients die after a cancer diagnosis. And this is a relatively good surrogate marker for 5 years relative survival. The other data we extracted from the International Monetary Fund and the World Bank. So basically wealth and health expenditure indicators, gross domestic product and GDP per capita, health expenditure as percentage of GDP, and health expenditure per capita. Also we extracted percentage of public health expenditure. So coming back to the results, we saw that the Western population is 4 times bigger than the Eastern population. However, the GDP, the sum of GDP is more than 10-fold bigger than the GDP of Eastern Europe. As a result of this, we see a perfect division between the two blocks, Eastern Europe and Western Europe, in regards to health expenditure. So I'm going to explain you a little bit what this graph is. If you see this bar, these are the health expenditure per capita in dollars, because this is how the World Bank represents it. So we see that, for instance, Luxembourg has the highest expenditure, more than $6,000 per capita per year per person. And if you see Romania, they expend around $800 per capita per year. The cutoff point between the two blocks is around $2,600, right? And if you see the dots are the percent of GDP invested in health. So you see the same trend. There's a decrease in the percent of GDP invested in health from Western to Eastern Europe. So this is the most important result of our study, is the percentage of patients dying after cancer diagnosis in relation to health expenditure. So I'm going to show you a little bit how it works, because it's a bit complicated graph. So if you see in the axis, you see the 0.3, 0.4, 0.5. This is a percentage, so 30%, 40%, and 50%. And in the other line, you see the health expenditure. So if you take around $1,500 per capita, you see that cancer mortality in the graph in the left is around 60%. So 60% of the patients die after cancer diagnosis. If we increase this expenditure to around 3,500, like in countries like Portugal, Spain, UK, we see that the mortality decreases for 45% after cancer diagnosis. And if we increase even more, for more than $5,000 per capita, mortality is inferior to 40%. We see more or less the same thing happening in the breast cancer, that is in the graph on the right. But this decrease in mortality is even higher. So when you take the graph of all cancers, the decrease in mortality between spending 1,500 to 4,000 is around 30%. In breast cancer, the same decrease is around 40%. So we conclude that the more you spend on health, the less you die after a cancer diagnosis. And indeed, this is particularly true for diseases where you have screening and effective treatments. So as you see, the correlation is very strong, this primary test. Thank you very much.